everyone. Thank you so much for joining us on another edition of our flagship program dubbed Your Health. This program explores everything health with seasoned professionals and experts. My name is Daniela Asari. I am here in Phoenix with Dr. Michael Adu-Tutu, and we're going to talk about a very important topic. Now, Dr. Adu-Tutu is a seasoned expert in the dentistry industry, and he's been working in this field for over 40 years here in the US and beyond. To today's topic, halitosis. We all know it as bad breath. Now, a bit of statistics tells us that 1 out of 4 people all across the globe suffer from this condition. In the US, over 50 million people have bad breath. These numbers tell us that this is a condition that we need to talk about. It's a widespread disease that we have to fix. And so without taking too much time, I think we should already dive in. Hi, Dr. Michael.
Hi.
Thank you
Daniela.
so much for coming here today.
You're welcome.
All right, so bad breath. Can we give a definition to bad breath?
Well, bad breath is defined as socially unacceptable breath. Bad breath is socially unacceptable breath, usually coming out of the mouth, and it's caused by several conditions.
Okay.
And the word socially is important as we dive into this topic, because in countries where people eat certain foods, it may be acceptable to have that kind of breath because they are used to it and it's common. So the word socially, it depends on the community and where it's happening.
Okay.
But for example, if the food that you ate is something that is pungent and is not acceptable, it will emanate as bad breath. And there are several other conditions we will dive into later.
Right. So can we say then that bad breath differs from depending on where you find yourself? Because if a meal tastes horrible, it has a pungent smell in one particular community but not the other, then does it mean that breath is acceptable in that community?
That's where the word socially
Okay.
becomes very important,
Right.
especially for a professional trying to diagnose and find out what is going on. Because if, for example, there are communities that eat a lot of garlic, okay?
Right.
And so they are used to the smell of garlic all the time. And garlic and onions, for example, can give a pungent smell to somebody who is not used to it.
Right.
And so that may be a definition or splitting hairs within the definition of the disease. But what one has to be cognizant of is overall, bad breath is socially unacceptable, bad smell
From your mouth.
from your mouth that comes out, and people observe that.
Okay. So now that we've been able to put a definition to bad breath, can we dive into some of the causes, like what is causing bad breath? I know you mentioned the garlics and the onions and some meals that might be pungent, but apart from those, like what other things cause bad breath?
Well, of course, we are talking about the mouth. So let's dive into what is in the mouth. Poor oral health care.
Okay.
See, as we eat, food build up within the mouth, around the teeth, around the gums, and everywhere. So if you are not able to properly brush your teeth, use your dental floss to go in between your teeth to get rid of those food and other things, the bacteria in your mouth, which serves a good purpose if they are in balance, will break down some of these foods.
Okay.
And then that would also cause bad breath. If you have, for example, poor gum condition or periodontal disease, the infection that is going on will also create a breath. In fact, sometimes that may be the first thing that will cause the patient to come and see a dentist. That they are all of a sudden they are having this bad breath and they are when they brush their teeth, the gums bleed and all those kind of things. But the breath alone may be a sign that will cause the patient a symptom for them to come to see the dentist.
Okay.
Apart from that, when you do not have enough saliva in your mouth, dry mouth, technically called xerostoma. When you have a dry mouth, for example, you are in Phoenix, you don't drink a lot of water, and you are dehydrated.
Yeah.
And therefore, you don't have enough water in your mouth. The saliva plays a good role for us to try and keep the mouth clean. And so, if there's no water there, sometimes you don't have enough saliva because of diseases affecting your salivary glands,
Okay.
the glands that produce the saliva to get in, or the saliva may be even blocked, the channel, a canal through which it comes into your mouth. And sometimes it's from the medications that the patient is taking. Okay, so those can cause some medications cause the mouth to get dry,
Okay.
and those things result in the bad breath, the bacteria staying in the mouth. I've mentioned that if you don't brush your teeth well, for example, if you don't brush the back of your tongue, the bacteria there, combined with some amino acids in the food that we eat, to create sulfuric smells and other things inside the mouth. So those are some of the factors. There are other conditions, that are not necessarily inside the mouth, but general health wise. For example, if you have sinus infection, respiratory diseases can also come in and mimic that, present as a bad breath. You have lung infection, as you breathe, it passes through the windpipe and it gets into the mouth, and then it stays there. Okay? And the conditions are worse in the morning because most of the time your mouth is closed during the night. Okay?
That's
Except
true.
those who have mouth breathers, their mouth is open all the time. And those can also have bad breath because of the dryness of the mouth, part of the xerostoma that I talked about.
Yeah.
So you have gum infection, you have lung infection that can also mimic and present like bad breath, bronchitis, for example. You have sinus infection. Sinus infection will also can present as bad breath in your mouth. You have postnasal drip. When you have sinusitis and you lay down, you can feel that something is dropping down to the back of your throat, and these are bacteria, uh, accumulation of bacteria that then from the back of your throat it gets into the mouth, and you open your mouth and it's the breath that you're seeing. You have other conditions like I've already mentioned, gum disease. That is very common. Diabetes. And in diabetes, for example, you have, of course, the periodontal disease, the gum disease, and diabetes go hand in hand. So it may be that you are diabetic and now all of a sudden you've developed this bad breath. It may be an indication that your care is not going well and you need to get to the attention of your professional. You can have in kidney disease, the kidney and the liver are two organs that serve to clean up the blood, okay? Clean up the toxins in our body.
In the blood.
And so if you have kidney disease, for example, you could have the ketones building up and resulting in the breath that you have. Liver disease, for example, when you cannot excrete all the toxins in, they can build up within the bloodstream and then present as bad breath. So
Okay.
there are other gastrointestinal conditions or disorders can also present like that. Stomach ulcers, which are we know are produced by H. pylori, which is another bacteria within the stomach, can also build up gas. In fact, these days we use the gas that is built up to test instead of using the methods that we used to use. It's because of the gas buildup that comes out of your gut
mouth.
into your mouth. And so those are some of the most common causes. And as you can see, there's a plethora of causes
Right.
that can mimic this. And sometimes it's the breath that pushes the patients to go and see a provider to get care.
Okay, I have a quick question though. So it looks like there's a lot more that causes bad breath than the average person knows. So I want to know that. So things like diabetes, the gastrointestinal issues, and all of those, is the bad breath is the bad breath the very first symptom or one of the initial symptoms before you can be diagnosed of diabetes or something, or it is one of the symptoms that comes with it? So an example, I know I have diabetes, and then along the line my breath starts being awful, so I know that it's not I have the diabetes already and then the bad breath is coming. Another instance is I have bad breath. Should I be worried that maybe that is a causative agent of diabetes? Like, I want to understand that one.
The difference is that when the diabetes, you may not even be aware, apart from peeing a lot and all those things that comes. You may be comparing it to maybe drinking too much water in Phoenix, for example, and that's why you're peeing. But the breath may be a cause for you too, because we now know that if you have diabetes, you have to take care of your gums because the periodontal condition gets worse. So
Interesting.
that will be a cause for you to, to make sure that your care, and sometimes you notice that you are following the treatment that has been even prescribed for you, but then all of a sudden you are developing these conditions, and that may be a sign for you to go and see your provider, and then we will talk about how to diagnose it and all those things, and then we will know.
Okay, it's very interesting to know because I really did not know that bad breath could be an underlying factor for really bigger diseases. It's interesting to know that. Yeah. Okay, so now that we've defined bad breath, we have tried to tell the plethora of causes of this condition. What are some of the symptoms? Obviously, it's bad breath, but what else could be a symptom of this?
Most of
condition?
the time is the breath, of course, and sometimes bad taste. Taste in your mouth.
So the food does not taste good?
Doesn't taste good. Okay. For those of us who lived in Africa, in Ghana, when you have what we call catarrh, you realize that you don't even feel like you want to eat anything.
Yeah, you lose appetite.
You lose appetite. Your mouth smells a lot because you are dehydrated for the most part. You don't drink any water. Okay, and for example, people who fast, they don't drink, they don't do anything, and then you find out that their breath, especially in the morning when they wake up and start talking,
right?
So that's some of the things that happen.
Okay, all right. So knowing the symptoms, interesting one among the symptoms is the loss of the taste. Food does not taste really, really good. Anyway, it's a good one to note. So now we know the symptoms. How do we prevent this? And I want us to do this in two different cycles. So there's prevention when you do not want that to happen at all. And I think there's the kind of prevention where you have it. I don't think we'll call that prevention though. I think that would be maintaining the condition or something like that. Yeah, so let's take the very first instance. Yeah, you do not have bad breath at all, or you do not think you have experienced any bad breath for a while now. Now you've heard this information, you want to be sure you don't even jump into that train. So what do you have to do so that you do not get bad breath at all, at all?
The first thing is what we talked about earlier about oral health.
Oral health.
Proper brushing, proper flossing, and the brushing should include your tongue. Brushing around the gums. See, for the most part, people think just going around and scrubbing their teeth is all that you need. But proper brushing involves more than that. It's going around all the teeth, including the back molars, and also flossing, using a dental floss to go in between the teeth, because food build up between that. Okay, and nowadays we also have some mouth rinses and others that help to reduce the bacteria buildup in your mouth.
Okay.
So proper. The second thing is making sure that you see your dentist regularly.
Okay, before we go on the
Yeah.
second one, I have a couple of questions on the first one. So, what entails brushing properly? I know you mentioned cleaning the corners and flossing properly, but what do you think about tongue scrapers? Do you think they do a good job?
Yeah, they do a good job by
Okay.
cleaning the back, especially the back of the throat.
Right.
You see, when you stick your tongue out and you open wide, you can see the bumps at the back of your tongue. Those areas can have food and others accumulating over there. And on the tongue itself, we have what I would describe as hair. Okay?
Interesting.
We call it philia, but
Okay.
to the general, hair will come the closest, as tiny hair on the tongue. And you can see that sometimes it coats white for people who have not been eating and that their tongue may be coated white. And those who smoke and drinks food and other things that have a lot of stain with them can have the hair. In fact, sometimes it appears like a hair, and we call it hairy tongue. Like the tongue may look like somebody has a hair on the tongue, and it's not. It's just poor oral hygiene.
Okay.
And so brushing your tongue is very important. And we recommend also sometimes brushing the roof of your mouth.
Okay.
Because there are spaces, there are things around there. So it includes that. But I know that most people will brush only the tooth or the teeth, and they are done. And you rapidly going around, and you so the proper brushing and making sure that you also get hydrated. We've talked a lot about hydration, and so it's important. You live in Phoenix, you need to find out drink a lot of water, especially in the summer months when you can easily get dehydrated.
Yeah.
And when you lose that, you will see that your mouth doesn't taste good. You don't taste anything good. And then you open your mouth and people are just trying to get away from you. So those are signs. Sometimes you yourself may not even smell it, but others,
Smell
make sure your friends could be honest with you and say, Daniela, something is wrong here, and be honest with you.
We'll come to that one about telling somebody, being frank with them and letting them know. But still on the brushing.
Yeah.
I had a quick question though about the kind of products we use to brush our teeth. Most products say they are dentist approved. Like, which one? Is there any one product? Of course, everybody says their product is dentist approved. Which one should we use? I don't want you to mention names, but like,
okay. I don't have any commercial interest in any of the products if I mention anything.
Okay.
I would use my experience as to what I use or what I recommend for my family members to use.
Right.
Okay. For example, most people that I have noticed in Ghana use hard toothbrush, which is very, very bad for your gums.
Oh, it is?
Because, yes, the gum, if the gum and the tooth, if you take your thumb as your tooth, okay, and you run your nail underneath between the skin, and the gum, you see there's a tiny space.
Right.
Okay. So with the tooth and the gum, there is about 1 to 3 millimeters between the recommended height of the gum and where the band hold the gum attached to the tooth.
Okay.
When that band is broken, which is usually the cause of infection, that's where you start having gum disease and all that. Beneath the gum is a softer part of the tooth. Okay? Let me take a second to describe in simple terms what a tooth generally will look like to a layman.
Okay.
Take, for example, a hard-boiled egg, and you slice it into two. You have the outer shell.
Right.
That's the pale, the white part of the tooth that we see, the enamel, technically we call it. Then beneath that is the dentine. Usually it's not white, but it's slightly yellow or whatever that gives color to your tooth, okay? Then inside,
Is the
the
yolk?
third part is the pulp, which is all where the activities take place. The nerve, the blood vessels, and all that are bundled in that area. But the dentine, which is the second part, also has nerves going through. And the eggshell stops just below the gum line, what I call eggshell, the enamel. So if you scrub that off, what you have is the dentin going down to the root. And that's where you have tooth sensitivity.
Oh, okay.
A lot of the hard brushing. So our recommendation is soft toothbrush.
Soft toothbrush.
Yeah, soft toothbrush. With regards to the dental toothpaste, for example, if you take a look at the back, the active ingredients on all the toothpaste, they are almost the same. So my recommendation is buy what is on sale and it's cheaper for you because they contain almost basically the same.
Okay.
If you take the toothpaste that for sensitivity, they basically are the same on the active ingredients. So always read the active ingredients. They contain, of course, make sure they contain some fluoride in it. And usually it's about 0.15 of the active this thing in it. Almost all of them. If you take a look at, let me use one of them, Crest or other things, then they are all around the same. Okay.
Okay. Yeah. Also, just a quick one. One more question on the brushing, and then we'll go ahead. Should a tongue be a particular color? I know you mentioned about something similar to hair, and then it's being colored, being white, and all of that. And then again, you mentioned we should use soft brushes. So, should a tongue be a particular color? And if so, how can you use a soft brush to get that color?
Well, you can brush if you get a film or something that has deposited on the tongue, like a white film or this thing, once you brush that off, whatever color you have, because the color of the tongue is not necessarily one color. It's just like in all the surfaces. For a black person, it may be slightly darker than the Caucasian or whatever. So there could be a difference. There's not one particular
color for your
color.
tongue.
But you should notice, that this is the color I have. You brush your teeth and you brush your tongue. There are other diseases of the tongue, which we will talk about in our series as we go along.
Okay.
When we talk about mouth cancers and other things, that will be part of our series. So people may tune in to hear about those things also.
Fantastic. Now, enough with the brushing. I think you mentioned brushing and flossing. Can we go down the line with the preventive measures?
Okay, we talk about the hydration.
Yeah.
Seeing your dentist.
Seeing a dentist.
Just seeing a dentist to examine. Okay? Because regular dental examination is very important. Most people think it's just that they are going to check their teeth. They have to check your gums. They have to check your neck, the lymph nodes around your neck and around your mouth. They'll have to check for cancer also, because you will not, just briefly, I know we will discuss cancer later, but just because you see a bump on your tongue or in your mouth somewhere, you may not even be aware, and that may be the beginning. Early intervention in a diagnosis always help
Right.
to resolve these things, because once the cancerous lesion becomes painful, it most of the time too late. So regular visit with your dentist is very important. Somebody asks how often.
Yeah, what's regular? Can we
I
define
think
that?
I see my dentist twice a year.
Twice a year.
Even though I don't have any decay, I brush as well as I can, and I floss and do follow all that. Still, once I was once told that the crocodile in the Nile River have some birds that come to pick on their teeth, and so it shows that it's important that we keep these white pearls that we have
Yeah.
to keep it regularly. But the dentists do more than just looking at the teeth and checking for decay.
Definitely.
The gum diseases, for example, if you are diabetic, I would strongly recommend that you see your dentist regularly, and your dentist may even recommend that you do every 3 or 4 months.
You
It
come
depends
visit
on what
them.
they say.
Okay. All right. So that being said, now I want to talk about people that might have the bad breath condition themselves. What are some of the things they can do to maintain the condition?
To improve on the condition,
Yeah.
Well, like I said, visiting the dentist
Okay.
as the first stop. So when the dentist examines and find out that he does not have a dental condition underlying this disease, then he may refer you to see your primary care provider,
Okay.
okay, primary medical provider, who will also run tests and other things on the conditions that I have already described. And for example, if there is a liver, your liver is off, he may then send you to a gastroenterologist to check what is going on. If it is your lungs, he would maybe send you to the pulmonologist. If it is your kidney that is producing these ketones in your urine and in the blood, then you may see a nephrologist. So all those things, your first stop is to see the dentist, and that comes as part of the distance. And if you notice that your breath is changing, but it's not time to see your dentist, call the dentist and get an appointment. Because in healthcare, early intervention
It's always the
is
best.
always the best.
Got it. Okay. So any other thing for someone with bad breath who wants to control the situation, apart from seeing the dentist often or regularly?
Well, some people try to use things like mint and other things to to cover it up,
Manage
but
it.
without taking care of the underlying cause, it doesn't last,
Yeah.
and it doesn't prevent anything.
Okay. All right. So thank you so much. I think this has been very insightful with all of the things we've spoken about. Any last words for everybody about bad breath?
Well, what I would say is, as we've already talked about, make sure you take care of yourself, brush your teeth well. Any changes in your mouth or in your breath, see your dentist as soon as possible. If you are not getting an appointment, see your physician, because if your physician could find the underlying cause, not medically the cause, and then you can also see. So both things should be of concern and then seriously addressed.
All right. Okay. Thank you so much. Thank you, everybody, for walking through bad breath or halitosis with us up until this point. If you have questions, if you have thoughts, any other thing across your mind, you can just put them down in the comment section and you will get your responses as and when they are seen. We will see you in another edition of Your Health. Thank you and see you again.